Surati. I'm here today with my friend Ari Nurmuhi and Jihan Lutfia Salsabila. We're all physiotherapy students currently continuing our student at the university. Today, we will present of the role of the physiotherapy in case of palsy. This presentation is intended to help explain how exercise can be utilized in the management of palsy. Palsy is peripheral paralysis of the 7 cranial nerves with unilateral and rapid onset. This condition is idiopathic and causes weakness of some all of one half of the face accompanied by change in tense, sensitivity to sound, and change in lacrimation. The motor function of the peripheral facial nerve is to control the muscle of the upper and lower face. The diagnosis of palsy pay attention to the strength of the forehead muscle. If the strength of the forehead muscle is good, then the underlying cause needs to be considered. Global data show the incidence of palsy is 15 until 30 cases per 100 population. This disease is the high cause of the unilateral facial paralysis in the world. Subjective examination. The patient complained of thickness on the right side of the face accompanied by weakness in the facial muscle on the side. Additionally, and the patient felt discomfort in the right eye area due to freak-out weathering. The symptoms worsened when the patient was in a cold environment or temperature, experiencing the stiffness in the right face. However, the complaint diminished when the patient rested or after applying a warm compress behind the right ear. The goal of therapy is to improve motor function and strengthen the facial muscle on the right side. That's all I can say about. Turning our attention to my friend Ari Nurmui, who will explain next point.
Physical examination. Physical assessment include examination of vital sign, infection, dan palpation. From the infection results, no swing or deformities were found in certain areas. The palpation results showed no tenderness, but there was still spasm in the muscle on the right side of the face. Examination of vital signs such as blood pressure, breathing rate, pulse, and body temperature shows result with a normal limit. Basic movement examination. The basic movement is assessed through examination of active movement. Weakness was found in several facial muscles, include frontalis muscle, oculator supercilii muscle, orbicularis oculi muscle, zygomatic major, orbicularis muscle, dan metalis muscle. Examination. Palsy is a sudden idiopathic paralysis on side of the face due to severe cranial nerve dysfunction affecting facial movement, texture, saliva, and sound sensitivity. To assess the condition, specific examination such as the Ugofish scale are used to evaluate facial motor function. Manual muscle testing atau MMT to measure facial muscle strength. Verbal dexterity scale atau VDS to assess the level of mind.
Next slide is the physiotherapy diagnosis or ICF. We have 3 levels of that. Number 1 is the impairment. In palsy, we have decrease in facial muscle strength, just one side, just left side or the right side. And then we have decreased functional ability in the face. Number 2 is functional limitation. Patient difficulty chewing with their mouth then difficulty to close their eyes. So there is the muscle weakness in the face. Number 3 is the participation restriction. Patients feel not confident when doing activity, so there is the insecure about their face. Let's now turn to the next slide. So this slide is the intervention of the physiotherapy in Bell palsy. In physiotherapy, intervention that can be used in Bell palsy is infrared, and then we can use the microwave diathermy, and then electrical stimulation. We can use the facial massage and then mirror exercise. Okay, so this is the last slide of the presentation. There is the conclusion. In conclusion, let me sum up my point about Bell palsy or about this presentation. So I have 3 points that I will explain. As number 1 is the definition of the Bell palsy. So the Bell palsy is a sudden one-side facial paralysis due to facial nerve dysfunction, causing weakness and facial asymmetry. But number 2 is the assessment tools that we can use for a Bell palsy is the UGOV scale, MMT, and VDS proof measurable insight into facial motor functional and pain. Is the last, or number 3 is the goals of the physiotherapy is the focus on improving motor control, restoring facial symmetry, and boosting patient to confidence in social participation. So thank you so much. That's all I have to say about the role of the physiotherapy in Bell palsy. Thank you so much for your time. See you next time.